Hello, everyone, and welcome. We're so glad you're here. We'll be getting started in just a couple of minutes as people continue to join. I just wanted to say thank you for making the time to be part of this session today. We've gathered a great group of our MAPflow users and innovators today, and we have a large portion of our team that's also here. Each one of you is really helping us shape what's next in real-time collaboration and purposeful alignment. So we thank you for being here, and we encourage you to please use the chat box and Q&A as you need. We will kick things off very shortly, so just sit tight, and thanks again for being here. It looks like we have a number of you on already. We are waiting for a bunch more, but we will get started just to respect everyone's time. So without further ado, I'm going to turn it over to Dr. Kenny Chong to kick this off.
Thanks, Nadine. Good evening, everyone. Thank you for joining us. Today is MAPflow's 2026 Q1 User Summit. Thanks to everyone for joining, especially those users that we have out in the Atlantic provinces. I know that this is a very late meeting for you, so I'm glad that you were able to join us. In this session, we want to showcase some of MAPflow's new and upcoming features that diversify the range of tools that we offer to support you in your practice. My name is Kenny Chong. I am Director of Clinical Innovation here at MAPflow. And joining us on the call also from our team, we have Nardine, Chief Executive Officer, Mikhail, Chief Technology Officer, and Mark on our clinical team, but also within sales. So just to note, this session will be recorded and then posted on our website at a later date. So here is our agenda for today. We're going to start off by talking about incident reporting and look at what's happening across the country, especially in Ontario, and talk about how MAPflow is supporting pharmacies with incident reporting initiatives. Then we're going to showcase our acute pharyngitis algorithm, show how it supports point-of-care testing in pharmacies, and how you can take advantage of our partnership with Abbott. Next, we'll take a look at our new service summary page to help streamline your workflow even further. We'll preview some of our other upcoming features, and then we'll have some time at the end to answer any questions you may have from the audience. So first on our agenda is incident reporting. And let's start off briefly by discussing what is happening with incident reporting across the country. So NAPRA released this document, this model standards of practice for continuous quality improvement and medication incident reporting by pharmacy professionals back in 2021. The focus or rationale behind continuous quality improvement is to reduce medication errors, improve patient safety, and enhance patient trust. And so these standards outline the roles and responsibilities of pharmacy team members in supporting CQI initiatives within the store. One of the key principles is that is woven into these standards is that incident reporting should not be punitive. Instead, we should be encouraging reporting and sharing of information within our pharmacies and more broadly, because learning how and why errors occur allows us to prevent them from happening in the future, thereby creating safer medication practices for everybody. So most of the provinces have launched or are launching incident reporting programs. This is a timeline showing the initiation of these programs across the country, starting with Nova Scotia in 2010, long before the NAPR standards were written. Um, it's important to note that these programs have evolved over the years, and you can see that Ontario launched its first version of its program in 2018, but as we'll see, it's going through significant changes this year. So to highlight the current state of incident reporting programs, I want to talk a little bit about the AIMS program in Ontario. And while the focus is on the Ontario program, many of these principles are shared between provinces. So AIMS stands for Assurance and Improvement in Medication Safety. And this is the latest evolution of the medication safety program developed by the Ontario College of Pharmacists. At its core, this program focuses on incident reporting, which already existed as a requirement within the province. But now there's also the addition of standardizing how incidents are captured and documented, a requirement for continuous quality improvement activities within the pharmacy, and sharing of de-identified data with a national database to improve system-wide safety. As with the NAPFRA standards of practice, the AIMS program focuses on error prevention. And the key principles surrounding reporting are that reporting is non-punitive, data is used for quality initiatives and not for discipline, and that there's a focus on system issues rather than individual fault. So in the spirit of these principles, the Ontario College of Pharmacists does not have access to individual incident details. The goals of the program are to move away from blame-based reporting to help identify trends across pharmacies, improve patient safety through shared learning, and to help pharmacy professionals improve care quality. So for Ontario pharmacies, what changes are required at the pharmacy level? And probably the most critical is that pharmacies are now free to select the preferred incident platform for reporting, which means that the onus is now on pharmacies to ensure that the platform you pick is compliant with the AIMS program requirements and supports your needs within your pharmacy to foster continuous quality improvement. On top of that, all registered pharmacy staff, except for relief or occasional staff, must have their own accounts to submit reports. And this includes pharmacy technicians as well as pharmacists. Other staff, so pharmacy assistants, non-registered staff, may have accounts, but it's not mandatory. The pharmacy must complete a safety self-assessment at least once every 2 years. And the pharmacy must hold continuous quality improvement meetings at least quarterly. These were suggested under the old requirement, but there was no frequency defined or enforced in the previous requirements. And then again, for Ontario pharmacies, when do these changes need to be in place? So pharmacies must be compliant with the AIMS program requirements by January 1st, 2027. 2026, this year is intended to be a transitional year for pharmacies. So during this time, pharmacies are still responsible for recording and sharing incidents, but they may use any system that they want. And that includes things like paper-based forms, if there's no other system already in place. Pharmacies must select an incident reporting platform that meets OCP criteria, and then they must have processes in place to ensure that all registered staff have unique logins and that they have procedures for ensuring that they're completing their safety self-assessments and CQI meetings at required intervals. So OCP is still updating the AIMS requirements periodically, so make sure to review their website frequently to make sure you are planning for the most up-to-date requirements. To support pharmacies with this medication safety initiative, MAPflow is launching an incident reporting platform. This platform will launch initially in Ontario, but we plan to quickly branch out to other provinces. And because we are now adding this incident reporting to MAPflow, we now need to differentiate between MAPflow clinical services and MAPflow incident reporting. So clinical services includes any services that were available on our existing platform, such as the assessment of minor or common ailments, chronic disease management, or prevention. And then we will have our incident reporting module. So our incident reporting is a new module that includes, as its core function, the ability to record incidents and submit them to the national database. We will also provide users with tools to support continuous quality improvement activities. And these tools are still a work in progress as we are working closely with feedback from OCP, ISMP, and our users to develop CQI tools that meet the college's program requirements, support the overarching goals of reducing preventable errors and improving patient safety. But we also want to make sure our tools are effective and easy to use to encourage pharmacies to report incidents. And then as part of our module, users will also gain access to ISMP's medication safety self-assessment so that they can fulfill the safety self-assessment requirement of the program. So the incident reporting platform is built directly into our existing MAPflow platform. What this means is that for existing users of MAPflow's clinical services, so if you're currently a MAPflow user, there will be a single login for you to use for both platforms or for both modules. And so you can easily switch between clinical services and incident reporting. And even though it's built into our existing platform, pharmacies do not need to be current users of MAPflow's clinical services to subscribe to incident reporting. So incident reporting can be accessed as a standalone module, even if pharmacies do not have an individual or per pharmacy subscription to our clinical services. And so with that introduction, let's switch gears a little bit and demo our incident reporting tool. Okay, so let's run through a quick preview of our incident reporting module. So you can access the module from the left sidebar when you log into MAPflow. This current page shows you a list of the incidents that have been reported by your pharmacy. And this is also where you can start a new report. So in this example, let's say that we had a patient who was prescribed hydralazine, but was accidentally dispensed hydroxyzine instead. Okay, so the questions and answers that you see on this form may vary depending on your province's program requirements. We've done the work for you to identify which questions are mandatory and which are optional so that all of your submissions are compliant with the program and you are the process is streamlined for you so that you're not dealing with a lot of unnecessary information. Okay, so in this example, we've identified that lookalike sound-alike drugs were a major contributing factor to this incident. We've also included reminders for our users that for free text fields, the ones that are submitted to the national database, they're meant to be de-identified. So there's a reminder here not to identify any information that may identify people or your pharmacy. And then this last page here is dedicated to internal documentation. So you can include identifying information here, such as prescription number or staff involved, to help you with your analysis of the incident. And this information will not be submitted to the repository, but this is optional information if you would like to include it. Okay. And then once the incident is complete, it will automatically generate a report for you that you can print off and share with staff for learning. Okay, and then let's also take a quick look at our dashboard. So our CQI dashboard here quickly summarizes information about your incidents to support your CQI initiatives. So at the top here, you have some summary statistics about your incidents, including your distribution of true medication incidents, so the ones that that actually reach your patient, versus your near misses or good catches. We also show things like your top incident types, your time of day or day of the week. So if you're noticing temporal trends within your incidents, it may be due to things that are happening at your store at the same time. So let's say inadequate staffing. And we have the section of quick wins here as well. So common trends, the most common trends that we've seen in your incidents that may be actionable to help prevent future errors. Okay. And then with that, let's go back to our presentation. Just give me a second. I lost my, oops. Okay, there we go. Uh, so we also have some additional CQI tools in the works. One of the functionalities will be supporting CQI meetings, and this will allow the users to schedule their meetings, but also plan agendas. So looking at things like who is attending the meeting, what incidents have occurred since your previous meeting, and then do you have any ongoing goals or actions that need to be followed up on? And so during your meeting, you can discuss your findings since your last meeting and then set new goals and actions as you move forward. And then speaking of goals and actions, so we will provide users with the ability or the tools needed to track their ongoing goals and actions, as well as the ability to create new ones as you identify opportunities for further change. So our incident reporting module will launch March 1st of this year, and our pricing of the module will start off at our standard pricing for the module will be $20 per month, and that's per pharmacy. So for one subscription, you can add an unlimited number of users for that pharmacy to the incident reporting module. If you are an existing user of MAPflow's clinical services, then you can access incident reporting at a discounted rate of $18 per month. And if you sign up now, so from now until the end of March, we have early bird pricing available, which is at $17 a month. So even though the program or the AIMS program doesn't officially launch until January 1st, 2027, you can still sign up now um, and access the incident reporting platform now beginning March 1st. And that will allow you to start recording your incidents electronically, especially if you don't already have a system in place. But another advantage we've of signing up now is that we've heard from various users that during their practice assessments with the college through OCP, OCP is now asking people what their plan is with respect to incident reporting. Um, so just keep in mind that the college is looking to see that pharmacies have a plan in place or that they have a system in place already in preparation for the January 1st launch date of AIMS. And when you sign up for our incident reporting module, you get access to the incident reporting form, all of the CQI tools that we will have available, and then also access to ISMP's medication safety self-assessment. Okay, so next we're going to look at acute pharyngitis, and specifically our acute pharyngitis algorithm within MAPflow. So we wanted to showcase this algorithm because it involves some additional steps that you might not be used to as part of your usual patient assessments that you've been doing for other minor and common ailments. So acute pharyngitis as a condition is unique because there are two stages of patient assessments. And the first stage is to determine the appropriateness of testing for group A strep. And the second stage or the second assessment is to determine what therapy is most appropriate for that patient. This algorithm in its full version with including point of care testing is now live within Prince Edward Island, New Brunswick, and Nova Scotia. It will be available in its complete form in Ontario once regulations are released. So, why is there this pre-test assessment, or why do we need to make an assessment before testing people for group-based trap? And as you may recall, many people are colonized with group A streptococcus. Colonization rates vary by age and season, but up to 20% of school-aged children are colonized with group A strep in the winter. And so testing everyone who walks into your pharmacy would result in a lot of false positives for bacterial pharyngitis and result in inappropriate overtreatment. So the clinical guidelines for acute pharyngitis reinforce the need to only test patients who already have a high clinical suspicion of strep throat. And then that test is to confirm the presence of group A strep. So pharmacists must clinically assess the patient first before determining whether or not testing is appropriate. And this clinical assessment requires some assessments that may be unique to or are unique to acute pharyngitis and may be unique to pharmacists or pharmacists may not be that familiar with them. And that includes things like palpation of the lymph nodes or inspection of the tonsils or pharyngeal wall. And so MAPflow has included clinical support tools within the assessment to help pharmacists with these assessments. Okay, and then as usual, with all of our algorithms, um, or with all of your assessments, you need to determine a therapeutic plan that is most appropriate for the patient. So the appropriateness of therapy may change depending on the pre-test assessment, the test results, the type of test that's used to test the patient, the patient's presentation, and other patient risk factors. So all of these considerations are already included in MAPflow's algorithm to ensure that you're providing the most appropriate care for your patients. Okay, and so MAPflow as we do in our other algorithms for the other conditions, MAPflow supports users in all steps of the assessment. So it walks you through the process of symptom triage to red flag screening, point of care test integration, all the way through the treatment and follow up, and all with automated documentation. And then along the way, we have complex decision logic woven into the assessment to help support you make some of those difficult decisions. Our algorithm is informed by many clinical practice guidelines, so the integration of recommendations from many reputable sources, as well as built upon or um, by our clinical content expertise. So our pharmacists who are experts in this material have reviewed our content to make sure that it is um, appropriate and at the level for use in the pharmacy. So some of the things that MAPflow does to support users with um, assessment of acute pharyngitis are things like prompting for testing only when clinically appropriate, um, and recommending therapies that are aligned with antibiotic stewardship goals. So, if you're familiar with the assessment of acute pharyngitis or the assessment of patients prior to testing for group A strep, one of the tools that we use or scoring tools that we use to determine whether or not a test is appropriate is a modified center score. And this takes into consideration various factors of the patient's presentation. This is where MAPflow's intelligence really shines. So based off of the responses that the patient has provided or the assessment that the pharmacist has done, we automatically calculate a center score for you. But on top of that, help you interpret what that score means. So in this example here, this patient has a modified center score of 2. And in this case, most patients with this score do not require testing or should not be tested for group A strep. If you're unfamiliar with the scoring criteria, our tooltips in MAPflow are there to help or to show you what the scoring criteria are, so you can actually see which patient factors actually contributed to that score. Okay. And then in this example, we have a patient who had a modified center score of 5. And so we also provide the recommendation here that patients with this score are good candidates for group A strep testing. So we would recommend that the pharmacist proceed with point of care testing for group A strep. And then, as I mentioned, along the way, we have additional clinical tools to support that assessment, that pre-testing assessment. So things like palpating the lymph nodes, inspecting the tonsils or the pharynx. Those are things that pharmacists don't typically do on a day-to-day basis, so they're a little bit unique to acute pharyngitis. And so we understand that pharmacists might need reminders or help determining how to do these things and where they're supposed to be looking or what they're supposed to see. We also have an antibiotic cross-allergy chart. So this is one of the few situations where pharmacists can prescribe antibiotics, and in the spirit of antibiotic stewardship, we want to make sure that we're maximizing the efficiency of our use of antibiotics. So we want to prescribe antibiotics that have a narrow spectrum, but are also safe for patients. So when patients report an allergy to antibiotics, we want to make sure that those allergies are true allergies and that we're not inappropriately screening out antibiotics that are the most appropriate for that patient. So this we have resources embedded that help you decide the severity of those patients of that patient's allergies and what medications can still be used. Oops. Okay, we also support users by automatically generating the billing pins um, for acute pharyngitis assessments. So depending on your province and the program requirements and the reimbursement structure, there may be multiple different billing pins that are available for you to use, depending on what happened during the assessment. So, um, did you uh, did you test the patient with point of care testing? What was the result of the test? What kind of test did you use? And so MAPflow automatically takes all the information that you've included in the assessment and provides you with the billing pins so that it reduces the guesswork for you, and you are submitting pins that are aligned with the assessment that you did with that patient. So these examples are from PEI. Other provinces, understandably, will have different pins based off of their program requirements. Okay, and then finally, I want to talk a little bit about Abbott's ID Now Strep A2 point of care testing. So this is a point of care tabletop molecular test for Group A strep, and it's listed as the preferred point of care test in several provinces, including, for examples, PEI and Nova Scotia. Because it's a molecular test, the test is highly sensitive and specific. Um, so if the patient has a negative test using the ID now, you don't need to have a confirmatory test um, using throat culture or whatnot, which was the case previously when only rapid antigen tests were available, and those tests were poorly sensitive. Um, with the ID now, your results are available in 2 to 6 minutes. So it's a very rapid test that can be done and supports patient walk-ins because of the rapidity of the test. So MAPflow has partnered with Abbott to distribute these machines and get them into pharmacies. And so MAPflow users can get an exclusive 10% off the cost of an ID Now device, which is in addition to any other discounts you may receive from your associations. So that in total can amount to a very significant reduction in the upfront cost of procuring a device. If anyone is interested um, in accessing this exclusive discount, please contact our support to receive a promotion code and more details. You can reach support@mapflow.ca. Just a note for our Ontario users, um, we don't, so the regulations have not, or program requirements of the Ministry of Health have not been finalized. So we're actually not quite sure what the reimbursement structure will be for Group A strep testing in acute pharyngitis. So you may want to hold off on actually purchasing a device until we get more information. However, you can feel free to reach out to support to get more information, or perhaps reach out to Abbott to get more information from them to get prepared for the release of the regulations. Okay, and then next, we want to highlight our new service summary page that we implemented back in December. So um, for our users that have been with us for a while, you might recall that once you finish an assessment, we had multiple different reports that were available, but they were all scattered across different pages. And so With our new service summary page, we've now simplified the workflow for managing reports. So we've consolidated all the reports onto a single page, including all their associated actions. We've created a new feature where you can manage documents in bulk. And we've redesigned the summary page to make sure that the key details of your assessment are front and center so that you can refer to them at a glance. Okay, so if you've done if you've completed any assessments since we've launched, which was back in December, then you've probably already seen our service summary page. You will automatically land on it once you've completed an assessment. And then you can also access it from any page where we have an assessment table. So from your dashboard, the patient profile, various other screens within MAPflow, by clicking on this service summary button. Okay, and then at a glance, this is what our service summary page looks like with all the components together. At the top here, we have the details of your service. So the patient that is provided to, the type of assessment, the primary care provider that was notified, plus any plans that you've made it for follow-up. So the date and the modality for follow-up. The sidebar at the right includes your details of your therapeutic plan, including any prescribed therapies, as well as any recommendations for medications or services. And then in the center, this is where the major changes come in. This is where we have our document management panel. So from this panel, you can access all of your individual reports that already existed. So, and then you can access all of the individual report or the report specific actions. So you can view the HTML versions of the reports to see what they look like. You can download each one individually. And then depending on other services that you have or other modules that you have within MAPflow, you might be able to schedule delivery for your prescription or e-fax the primary care provider of the notification form or send a link to the patient by text or by email of their patient report. We also have this bulk document management feature now, so you can download or export all of the reports either as a combined PDF. So this is useful if you frequently print off all of your reports. You can select which ones you want to print and then download them all together into a single PDF so that you can print it easily. Or you can download all of the files as a zip archive for record keeping within your store. Okay. And then we also have the ability to select various languages from the screen as well. So if you need to, you can for example, print off your pharmacy assessment records in English for the store, but then print off the patient report in French because they're French speaking. And so yeah, so we've implemented these changes based off of feedback about the navigation between pages, and hopefully that having all of these documents consolidated into one location has helped to streamline your workflow just that much more. Okay, and then coming soon. So coming through our pipeline, we have the next thing coming through our pipeline is support for prescription renewals. So this is specifically not this will all provinces, pharmacists in all provinces have the authority to renew prescriptions, and so our assessment or our form is designed to help ensure that you have all the proper documentation in place to make sure that you're meeting the requirements of your province. And especially if within your province, or if your province allows reimbursement of renewals, if you get paid for the service, making sure that you're meeting the program requirements as well. So making sure that all of your documentation is in place regarding indication, safety, efficacy, compliance of those medications, and any other factors that you need to consider when renewing. Um, we so we can't officially announce anything at the moment, but hopefully coming up in the near future, we'll be able to make some announcements regarding integrations with pharmacy management systems. So if you haven't already, subscribe to our newsletter or follow us on social media to stay up to date with our new and upcoming features, so that you don't miss out on any announcements. Okay, and so that concludes our my part of the presentation here. And now I would like to open it up for any questions that we have from the audience.
Thank you, Kenny, for that informative presentation. I do see that the Q&A is giving some people difficulty, so please do use the chat if you have any questions, or raise your hand and I can unmute you. So go ahead and put any questions, thoughts in the chat. I do see Alan has raised his hand. Alan, it's wonderful to see your name there. I'm going to unmute you in a second. There you go. It says you're unmuted on my end, but I don't think it's working there.
Now can you hear me?
Yes, perfect.
All right. Thank you for that, for the presentation. It's a great presentation. Doesn't seem as if the chat function is working. I think there may be some issues. I think it seemed as if it was just the organizers that had access to that. Anyhow, I just wanted to find out if these slides are going to be made available to the people who are registered.
Yes, absolutely. So the slides will be, and the recordings of all webinars do live on MAPflow Academy, which is available to everybody. So I'll put a link in the chat to where those are housed, but absolutely, Alan, for sure.
Okay, perfect. Thank you.
Would love your insights and comments as always.
Happy to give.
Thank you. I do see Adnan in the chat is asking about information about subscriptions, how to subscribe to the newsletter. So the link is now placed there. So feel free to add your name and information there, and you will just be kept up to date and up to speed with all of our future features and events. And anytime there's also any news releases across all the provinces that we support, and we're currently in 9 provinces. The only province we're not supporting yet is Saskatchewan. So we are supporting all 9, and we do release information very regularly on those provinces and their scopes of practice and how MAPflow is adapting the platform to meet their needs. So please feel free to sign up if you haven't already. It's, of course, a free newsletter. Kenny, if you don't mind, can you update the group on what happened last week, February 2nd, in Nova Scotia, and how MAPflow has adapted the platform for those folks?
Sure. So in case anyone is unaware, as of February 2nd, in Nova Scotia, the province started to cover a substantial number of new pharmacy services for all community pharmacies. So within Nova Scotia, there existed already primary care primary care pharmacies, and they were reimbursed for providing various services such as minor ailments, minor and common ailments. But if you weren't one of those primary care pharmacies, then you were allowed, it was within your scope to prescribe for common and minor ailments, but you weren't reimbursed for most of them. So, so as of February 2nd, now a large number, I forget what the actual number is, I want to say 29, maybe more.
29. Yeah, 29.
Common and minor ailments within Nova Scotia are available for reimbursement from all pharmacies, and so we, this is a great progress within the province, and really speaks to the quality of primary care that pharmacies deliver there, and the support that the pharmacies have from the province. So within MAPflow, we've updated our system to automatically generate all of those billing pins for those Nova Scotia pharmacies that are performing those common and minor ailment services for patients.
I do see something in there from our beloved Stephanie. So Stephanie asked, would it be possible to add the fax function to the prescription in addition to the doctor notification? That is a great suggestion. I don't know, Mikhail, if you want to take that one.
Yes, hi. Yes, I just replied already and just said I think it's a great idea, and we can put it into our next release.
I did put links in the chat for incident reporting and Academy and where the old summits are. In addition to that, if you haven't explored Academy, please do so, because for strep and what Kenny was just describing, we have an entire video that was created in partnership with Abbott. And I'm going to put the link here for the clinical hub under strep throat. So you could see the integration of point of care testing with the MAPflow algorithm just right from within Academy. It also links out to different resources that can help you assess lymph nodes, and understand how to use the device, the Abbott ID now for strep testing. So that's there as well. And the last thing I'll say, if I don't see anything, oh, somebody else has a question. Is there a confirmation for the fax on the platform?
Well, so I'm just going to reply as well here. So you can see that the status of the fax right now, but it's not very intuitive. And so one of the next updates of MAPflow will also have some kind of an administration of all the fax being sent. So you'll be able to see the history of faxes, when they were sent, which number, the status, and all of this. So you'll be able to basically have at a glance an overview of what happened. So yes, you also see the confirmation, for instance.
Right.
For currently, if you want, I don't know if this was clear, but if you want to see the confirmation, I believe you just hover over the fax button within that for that assessment, and it'll tell you what the status is of that fax.
Yes. So in terms of history, it's not implemented yet, but it will be released in our next release. So it's coming. Many people have asked to see the list of previous factors. So yes, we are listening to our users, and that's why I mentioned before, if you have features that you want to see in the platform, just send to an email or even on the chat like this, but even an email to the support, and we always try to add those small little tidbits as part of our main release as well.
That's right. And I will say, Kathy, I'm not sure what province you're logging in from, but if it is Ontario, I can confirm that the Ministry of Health, or ODB, does not require fax confirmation for notification of the primary care provider for minor ailment services. It is specific to MedsCheck. When you are notifying the doctor for any changes that have been made, that is a requirement. It is not the same for minor ailment services. So just an FYI, any features we implement for you to see the history is just going to be for your own use. But yeah, you're welcome. That is always not clear, but we have gone back and forth with the ministry, so I have clarification on that and I can share that. And this is the form for general feedback if you have general feedback, or you could just email support as well. Any other questions or thoughts? considerations. We love these opportunities to interact with our users and those of you who made the time tonight for us. So you could raise your hand as well, and I can unmute you if you prefer to use the mic. No, I don't see anything. I don't see anything in the chat. Go ahead, Kenny.
I just want to say it one more time. Mikhail already said it, but I want to say it again. Please reach out to us at any point. The email, support email is in chat there, support@mapflow.ca. We always want to hear from our users and get more feedback on what features you want to see, or how we can improve certain things. We're not always aware of what it is that that you need specifically for your practice. So I encourage people to speak up. You don't doesn't have to be within this setting, within this summit, but at any point in time, feel free to email us if you ever think of something where it's like, I need a tool that does this, or this can be improved in a certain way. We always appreciate that feedback.
So we just got another question in the chat from Emad. Is there a way to start paying for AIMS in January? I'm going to assume this is clearly about Ontario because it's AIMS specific, and AIMS is an Ontario specific requirements. So I will turn it over to the team about that.
Yes, so absolutely. Like right now, what we offer is the early bird pricing that you can log in, but otherwise, if you're just waiting until January, then you can just start paying the normal price, either like $20 a month if you don't have a MAPflow license. Otherwise, it will be $18.
And then keep in mind that there are some administrative things that need to be taken care of in order for you to be compliant with the program, and that might take some time. So, and even though the start date is January 1st, 2027, you probably want to get everything set up and ready to go before then. Give yourself a buffer time to make sure that's all set up. So there's a lot of there's paperwork, agreements that need to be signed, and then also there's January 1st is during the holidays. There's going to be a big rush for pharmacies to do this all around that time. So we encourage you to get that set up earlier rather than later. And I mean, you can also start using it right away, even though the program isn't in place or officially in place until January 1st. You can use MAPflow or whatever incident reporting platform to start recording your incidents within your store, because that's still a requirement. You still have to do that throughout 2026.
All right, excellent. I don't see any other questions or comments in the chat, so I am going to consider this. You're welcome. I'm going to consider this a successful webinar. Thank you all for joining us. Give you back your 6 minutes of the evening. We really appreciate your support and your continued support of MAPflow and of us, and of spending this time with us. I know it's very valuable in the evening. So thank you all, and we look forward to hearing from you and continuing to support you with the clinical side and with incident reporting. Have a great night.
Bye.
Good evening, everyone. Thanks for coming.